Thank you all for the incredible work that you're doing. I've mentioned to several of you here that I've been doing research on addiction for 20 years now, and the primary thing that I've studied is the extent to which alternatives could potentially serve as a prevention and a treatment element for addiction. For a while, this was more of a theoretical notion, but it's really incredible to see how our prevention models have advanced from just say no and sort of scare talks into this understanding that we actually have to change the environment if we want people to use risky substances less. So thank you for all that you're doing. I want to also acknowledge all of the graduate students in my lab at the U of M over the last 20 years who have done most of this research, as well as a number of collaborators and NIAAA for funding all of the research that I will discuss here. So in terms of overview, I'm going to start with just a little bit about the epidemiology of alcohol and drug misuse, right? And there have been some substantial changes over the last decade that I think are relevant. And then I think in order to be able to effectively prevent and or reduce substance misuse, we need to really understand the theoretical models and the basic research that points to the factors that contribute to why people use drugs, right? And so I'll talk a bit about that. And then I'm going to talk about specific research supporting substance-free activities as a prevention and intervention mechanism to reduce risk. I'll talk about implications for community-level prevention, the work that you all do. And then if we have time, I'm going to end with some of the work that we do in our lab, which is about brief interventions. So brief, 1 hour to 2 hour opportunistic discussions with young people that motivate them to engage in future-oriented and enjoyable substance-free activities. So that is our agenda. And let's see, we started at about 12:20. So I guess I'll go until about 1 o'clock and then save time for questions. So I'm going to go quickly just because we've got a lot to get through, but email me if anything is unclear. So all of you know that over the last 20 years, the U.S. has undergone a historically unprecedented increase in addiction and suicide overdose deaths, right? This was largely driven by increases in opioid overdoses, but it's also true that about 25% of those opioid overdose deaths were connected with alcohol. So it was a combination of alcohol and opiates that led to the fatal overdose. A large number of suicides also involve alcohol, and there's also been a massive increase in alcohol-related deaths as well. You can see here the increase in alcohol-related deaths just over during the 5-year period up until 2021. Thankfully, finally, over the last few years post-COVID, we're finally seeing reductions in all of these categories of death. So all of the prevention and treatment work that's been happening has finally started to curb this addiction overdose death epidemic. But relative to where we were 20 years ago, when this was still a massive public health problem, we're still at historically high levels. So there's still a lot of work left to be done. So young adults, teenagers, emerging adults are an especially important population in terms of alcohol and other drug prevention and treatment. Why is that? Well, most people start consuming alcohol and using drugs in their teens and early 20s. And so you have really high levels of, this is binge drinking. So about a quarter of 25 to 35-year-olds report binge drinking. Now, 5 years ago, when I was presenting these data, the peak age group for risk, as many of you may recall, was 18 to 24. But look what's happened. It's shifted later, right? Teens and early 20 folks are drinking less. So that's a massive success for public health and community prevention workers such as yourselves. The message has gotten through to young people. Unfortunately, though, there's still high levels of binge drinking. So again, more work to be done. And what we're seeing is a shifting towards increasing binge drinking during the later 20s and early 30s, right? So this work is still important. And I think a lot of the prevention messaging that used to be, when I started it would be 18 to 22, then it was 18 to 24. Well, when we do our work now, it's 18 to 30 or 18 to 29, because what we realize is that that age of peak risk is getting later, and especially for folks who are from more marginalized racial ethnic groups or who don't have a college degree, those risk periods are later, right? It's not so much the 18 to 29, 18 to 22 college years, it's those later 20 years, right? So in addition to targeting teens and early 20s folks, we really need to find models that reach folks in their later 20s and 30s as well. I think many of you appreciate, right, that alcohol and drug use disorders are not a binary thing, right? It used to be either you're a quote unquote addict or you're not, right? Now what we realize is that there's a whole continuum of alcohol and drug use severity. And you have on the far end of the continuum people who would meet criteria for a severe AUD or SUD, also called addiction, right? But thankfully, that's a small percentage of the population. A much larger percentage of the population engages in occasional risky drinking or drug use, right? These are people with mild to moderate levels of problems. They're not going to show up in AA or NA meetings or treatment, right? For decades, our field ignored that population, right? And sometimes those people would then escalate and turn into people with more severe addiction. Well, it's much more difficult to resolve a severe addiction than it is to change an occasional binge drinking pattern, right? So what we've realized over the last 20 years is that what we call the prevention paradox is that if you actually have services targeting people who have mild to moderate levels of use, right, you have a larger public health impact because there's a much larger percentage of people. The challenge is you have to go out into the community and find those people. They're not going to raise their hand and show up for treatment, right? And so we'll talk about how we might identify those folks, and we'll talk about what we know about what facilitates changes in young people with mild to moderate levels of severity. And so when we talk about risky drinking, as many of you know, there's sort of two dimensions to think about, right? There's episodic heavy drinking. So going out on Garnet Street, right? And having a binge episode, right? Under Eve's watchful oversight, that's where you have risk for a bad thing happening in the moment, right? So that's where we talk about avoiding binge drinking. But increasingly, there's also recognition that there's other people who might never binge drink, but they might have 1 or 2 or 3 drinks every single night, right? They're not falling down the stairs, but they're also not sleeping well. They're not maybe reaching their potential as a student or as a partner or as a parent or as an employee, right? And they're suffering long-term health consequences, irrespective of what the beverage industry would like us to believe, right? Even moderate drinking is associated with health risk. There was a landmark study published in The Lancet a couple of years ago that showed relative risk for decreases in what we call disability-adjusted life years as a function of how many drinks you have each week. For every drink you have in a week, on average, you incur a greater risk of a reduction in your disability-adjusted life years. What that means is essentially you will be sick or unwell earlier in your life, and you will not live as long. So this is really sobering and suggests that even lighter drinking is not enhancing health, right? And from a prevention and a harm reduction perspective, it's powerful because it also suggests every drink you reduce per week is meaningful in terms of maximizing your long-term health. And evidence like this, in addition to all the work that you all have done, have led to this movement in our society, right, where people appreciate that just because, when they look at what their grandparents did and they watch Mad Men, right, and I love that show, but they see the 3 martini lunches, right, and every professional event, instead of coffee, needs to have alcohol, right? They look at that and they say, you know what, that's not me. That's not what we're doing now. So I think data like this and this sort of cultural movement create a great opportunity right now to further enhance these reductions. At the same time, as we're seeing an increase in sobriety and people cutting back on drinking, there's also been an increase in people with severe alcohol use disorder, as I mentioned, and people dying. I've talked with liver doctors who say they're shocked over the last decade to see the number of people, even in their 30s and 40s and late 20s, who come in with severe liver disorder, right, from heavy drinking, right? So again, a lot of progress, but there's still a lot of people who are using really heavy amounts of alcohol. And so again, prevention efforts need to be guided by a scientific understanding of why people use alcohol and drugs. And we all know, we've known this for a while, right, that people use drugs in order to feel good or to feel better, right, and to do better, right? How many people had coffee this morning or some other form of caffeine, right? We want to do better. We want to have more energy. We want to not lose our train of thought, right? Coffee is really good for that. And also curiosity and social pressure, right? And to alleviate boredom, right? And so, but one thing that didn't used to be on this list even 10 years ago, because I think we didn't really accept it as a field, right, is that people use drugs to connect with other people. When I was in graduate school, the message was, we have alcohol expectancies and we have these false beliefs that alcohol leads to social connection and bonding, right? And then people did research, right? And there's a researcher at the University of Pittsburgh, Michael Sayette, who would bring people, college students, into his lab, which was a bar lab. How cool! It had lights and he would bring them in, make sure they didn't know each other, and sit them around the table like that. And it was an experiment. So under one condition, they got placebo beer, right? But they didn't know that they got placebo beer. In another condition, they were randomized to get real beer, right? And then he had a camera and he said, talk amongst yourselves, right? And they had coders who also didn't know whether these folks got real beer or fake beer. And these coders took copious notes and said, how much laughter was there? How much reciprocal conversation? How many of the real smiles, right, occurred? And guess what they found? The condition that got real alcohol had more of that good stuff, right? Now, that's not to say expectancies don't matter at all. But what we realize now is that there really is something in the chemical that reduces inhibitions. And in particular, when it comes to meeting people, new people, that's where alcohol tends to have the greatest social facilitation effect. If it's established friendships, it really doesn't matter, right? But when it comes to meeting new people, alcohol is a very potent social facilitative component. So people use substances in order to connect with other people. And that's important for us to appreciate. So behavioral economics, right, is this idea that just like consumers, when they decide how am I going to spend my money on one good versus another, they look at how much it costs and what the benefit is. Well, similarly, people, when they decide how they're going to spend their time, right, they think about how enjoyable is it, and what's the effort required, right? And things that are really enjoyable and require little effort, we do over and over again. That's reinforcement, right? So alcohol makes us feel good, and other drugs makes us feel good, and often there's not a lot of constraints, right? And sometimes, for most people, there's also a lot of other things that make us feel good, right? We walk outside and we feel good, right? Go for a run, right? We learn things, right? And so for most people, there's this nice homeostatic balance where alcohol's in its place, right? Other things are in their place. And that leads to most people having moderate amounts of alcohol once in a while, right? Because alcohol's a reinforcer, but so are all these other things, right? But what happens when somebody's in an environment where there's not a lot of other ways to experience reward, right? So in that environment, as it turns out, the relative value of alcohol is greater and other drugs, even if nothing chemically changed in their brain, even if there's no genetic difference, right? Holding everything constant, if people are in an environment where there's less access to alternatives, the relative value of substances increases. It's a very simple notion, but it's also really powerful. And this doesn't mean that people make a conscious choice to develop an addiction. What it means is that people are subtly sensitive in how they make these choices about whether and how much to use drugs. They're sensitive to how easy it is to access the alcohol or the drug versus how easy it is to access other ways of experiencing reward, right? So there's two complicating factors to this choice dynamic, right? Number one, as I alluded to, is that it's not really fair to say for most people, especially young people almost universally drink in social settings, almost universally. We've done careful studies, and for people in their teens and 20s, it's extremely rare to have solitary drinking. So the choice often is not between the chemical reward versus other reward. It's between the drug reward plus social reward, and not just any social reward, but social reward where people are having a really good time, right? And so this is what we're competing against. We're not just competing against drug reward. We're competing against this sort of really good time. And for young people for whom the most important developmental drive is social connection, right? And then you have a substance that enhances that, the deck is sort of stacked against us, right? And so this is important to appreciate. The other thing we have to appreciate is that many people are in beautiful, enriched environments like this. I love being here. This is an incredible location. There's so much to do, and yet people still drink a lot. Well, how is that? Well, as many of you know, when we think about how valuable something is, right? As humans and other animals are the same way. We want to maximize immediate reward. The most valuable reward, right? A bird in the hand is worth two in the bush, right? We want things right now. And things that result in immediate low effort reward are incredibly potent, right? We like to feel good right away, and we don't want to have to work a lot for it. And so on the y-axis here, right, this red curve is the drug reward curve. And you could see when you take a drug, you immediately get a real spike in reward, right? Whereas the blue represents substance-free activities. Think about learning how to play piano or starting a fitness routine, right? When you've been injured or you haven't been active, right? Or developing a new friendship, right? It's awkward. I don't really want to go out and meet these new people. It's stressful. The immediate return is often negative, right? But it's only when you engage in that pattern of substance-free activity over time, which is what we have here on the x-axis, that you get positive value, right? Whereas a pattern of substance use over time often results in net negative value, right? Well, we know people with an underdeveloped frontal lobe, they have a hard time thinking about that, right? So what could we do, right, to make people, when they're thinking about how to spend their time, right, to be more aware of the future? Well, one of the things that we do that I'll talk more about is we ask people what they want from the future. You know, what do you want to be, what do you want to do in a few years? What's important to you in life other than drinking? What are your goals, right? Who are you as a person, right? We also get people to keep track of how they spend their time over days and weeks, right? And when they look at how they spend their time, how many hours they spend drinking versus how many hours they spend exercising, studying, connecting with their family, volunteering, right? Well, what does that do, right? It's like when you try to record, if you know, trying to lose weight and you keep track of your calories, or trying to exercise more, you keep track of exercise time. Anything you keep track of allows you to have more self-regulation, to be more future-oriented, right? So these are the sorts of things that I'll talk about that we do to shift people from thinking about how to maximize value right now, which for a young person is probably going to mean using a substance, right? Versus how do I maximize value over time? Okay. That said, right, there is compelling evidence that enriched environments are associated with less drug use. And this started with animal research. So in the 80s, it was a decade of the brain, right? And how many people remember this? It was all about the disease model of addiction, which, you know, the brain disease model replaced the moral model. That was a big development, right? That was a huge improvement. But the whole focus was on addictive personality and the addictive nature of drugs. If you put an animal in a cage and you give it access to cocaine, I remember the commercial, it will chew its leg off to get access to more cocaine. No, it turns out that's a little bit true, but only under certain conditions, right? If you have a cage like that, where you have a rat in a cage and there's literally nothing to do but press a lever and you get cocaine, You have food and you have water, but you have nothing else to do. Yeah, that rat will press that lever thousands of times to get access to that reward. But this is called Rat Park, right? These are the Park Avenue rats or the San Diego rats, right? They've got running wheels, right? They've got friends. If you give those rats cocaine, access to cocaine, they'll try it, they'll dabble, right? But they won't use that much, right? And if you raise a rat in that environment versus that environment, and then you later put them both in the same environment, guess which ones use more? The ones that were raised in the deprived environment. And if you take the one that was raised in the deprived environment and then you put it in the enriched environment, guess what happens? It uses less, right? This one study here, so the higher bars reflect a group of rats that were addicted, right? And then you literally just give them access to a running wheel. And the other group, no running wheel. Look at that difference, just literally because of a running wheel, right? Now, these are rats, not humans. We can't ethically do experimental research with humans, so that's where animal models are really informative, because we can. Genetically identical, right? So we control for everything else. This is the effect that you get, right? Well, what is reward deprivation with humans, right? It's complicated. It's a lot of things. Obviously, it's poverty, but it's also experiencing marginalization, right? Discrimination, racism. It might be having chronic pain or having a medical condition or depression or anxiety, right? Anything that prevents you from experiencing reward is going to make the relative value of drug rewards greater, and therefore is going to confer risk for addiction, right? And of course, it's a vicious cycle, because when you don't have a lot in your environment, you use drugs more. And what happens when you use drugs a lot? What does it do to your brain? It changes the set point, right? Because the threshold for experiencing reward from anything else other than drugs, if you use drugs a lot, is going to be higher, right? So when you use drugs a lot and then you go outside on a beautiful day like today, it's all right, but it doesn't really feel like it does for the rest of us, right? So that's anhedonia, right? The inability to experience pleasure, which is part of early recovery. The great thing, as many of you know, over time this returns, right? But we have to appreciate with people early in recovery, their ability to delay gratification and to experience reward from non-drug activities is greatly diminished. And so if we want to support that, we need to provide immediately enjoyable, easy to access sources of reward. If we make them work really hard in order to access a non-drug reward, it's less likely to happen. Over time, we get good at this, right? The more time you have without using a lot of drugs, your ability to delay gratification, to organize your behavior around future outcomes increases, as it does for people in long-term recovery. But early on, we need to scaffold that. Similarly, if you ask an 18-year-old, right, to delay gratification, it's not easy. So it's really helpful if we want to provide alternatives that they're really fun, right? They got to compete with all those bars, right, which are easy and fun. All right. In addition to the animal research, of course, there's epidemiological research. Drug overdose deaths in the US are not normally distributed, right? They more likely occur in areas where there's deprivation as a function of all these indices. All right, I need to move quicker because, so addiction it's a brain disease and it's also an environmental disease, right? It's not either or, it's both and. All right, let me talk about some of the young adult research. We did this study in Memphis, Project Beta. We recruited 600 young people from the Memphis community, diverse sample. Memphis is a majority Black city. And so this sample was approximately reflected the Memphis area. And we purposely didn't just recruit college students. So over a third of our people were not four-year college graduates or students. And it was a diverse sample. They were all risky drinkers at baseline. They were around age 22 to 25 at baseline. We followed them for 3 years. The pandemic happened during this study, so we have pandemic effects. We studied that as well. And we, again, followed them for 4 years. And what we were interested in is understanding whether or not the proportion of all of your enjoyable activities that are related to substances, whether or not that predicts your long-term drinking trajectory. So you have two young people, and they both might drink 20 drinks a week. But for one person, the drinking is like the only way they have fun, right? For the other person, they might love drinking, but they might also really love basketball, and they have a job that they love. They've they're well connected with their family, right? So 20 drinks per week has a different meaning for one person versus the other based on their experience with other activities in their environments, right? So really trying to identify that specific variable. So what did we find? Well, just like research suggests, people reduce drinking over time, but look at the difference between our more privileged college students or graduates, which are the blue group, versus the green group who did not have a 4-year degree. Heavy drinking is plotted. Look at that. At baseline, much greater risk in the non-college group, right? And so when you think about prevention, think about ways you could reach not just more educated communities, right? Of course, when you're in college, you're at great risk because the college environment is often alcohol saturated. But in the post-college years, people without a college degree are at much greater risk for lifetime addiction. And so this is how we quantified reinforcement from substances versus substance-free activities. We gave people a long list of activities. This is just 4 of them, but there's a long list. And we said, how often do you do the activity and how much do you enjoy it on average? And we separated the activity when they're drinking or using drugs versus without, right? So we quantified drug-related versus drug-free reinforcement, and then we created a ratio. We call this the reinforcement ratio. What percentage of all of your reinforcement portfolio is related to substances? So this is the person 24 drinks a week, but only 15% of their reinforcement is from alcohol or other drugs. They do a lot of other things. This other person, 24 drinks a week, when they're not drinking, they're watching TV, right? They're like that guy in the couch in the picture before. And this number, it turns out, predicted trajectories of drinking over 3.5 years, controlling for baseline drinking, mood, all these other variables, right? And this was Samuel Acuff, who was a graduate student in my lab. Now he's at Harvard University. He was a lead author here. And this provides real, I think, evidence that increasing access to substance-free activities could really help people mature out of heavy drinking, right? And so this provides support for prevention and treatment approaches that increase substance-free activities. But we also want to know, many of you want to know, which activities are most important, right? So let's talk about that. So it's not only activities that occur in the evening, which is the predominant time when most young people drink. So this is called an alcohol demand curve. This is a measure we developed where we ask people to imagine they're at a bar or a party and they're there for 5 hours, and we say, how many drinks would you have if they were free? How many drinks would you have if they were 25 cents, 50 cents, $1, $2, $4, $7, $20, right? And then we plot their responses to get an economic demand curve, right? And just like with any commodity, people are really price sensitive. The more expensive drinks are, the less people drink. So that's interesting, but intuitive. But then we also did an experiment where we said, all right, imagine, and these were college students, you're drinking on a Thursday night, you don't have any classes the next morning. Well, that's that top group there. Look at how many drinks they said they would have. If drinks were free and you have no classes the next morning, 11 drinks, right? That's scary, right? If drinks were free, but you had class the next morning at 9 a.m., 7.5 drinks, big reduction. If drinks were free, but you had a test the next morning that was worth 25% of your grade, look at that, over a 50% reduction, 4 drinks, right? And of course, price has a massive effect as well. So what this suggests is that even young people, they're more of a rational consumer than we think. It's not this completely out of control. They're sensitive to the environment, right? Drink price and what's expected of them the next day. Well, what about people in their 20s and 30s and 40s? We did a similar study. This is Brandon Miller, who's a student at Kansas who led this study. And we did the same kind of demand curve, except we asked about, well, what if you had work the next day? We'll look at the reduction with work. What if you had a job interview? Massive reduction. What if you had to care for your family? What if you had a group fitness class? Big reduction, right? Volunteering, going to the gym with friends, right? People are sensitive not only to same night alternatives, but having stuff the next day, having responsibilities. The same Project Beta, we also, this was a study led by Beth Lehinger, who's a faculty member at University of Washington. We asked people that reduced their drinking in beta, right, these over the 3.5-year period. We said, well, what was the biggest thing that led you to reduce your drinking, right? Very straightforward. And this is what they told us. They said 51% said changing a job helped them reduce their drinking. Really interesting, right? Changing their diet, 42%. That's really interesting. We were surprised to see that, right? Again, this whole wellness movement. People are really interested. Alcohol is a food source. It's a calorie-dense food. People change their diet, and that leads to a reduction in drinking, right? Change in social group, increased hobbies, 39%. I summarize it here. So these are the categories endorsed by over 10% of young adults. Changing job, diet, social group, and/or romantic partner, changed living situation, changes in their finances. Actually, a lot of people, when they had less money, drank less, but then other people said when they started to really think about saving money, they drank less. So that could work in both directions. Social media, many people said using more social media led to a drinking reduction, but even more people said using less social media led to a drinking reduction. Increased hobbies, exercise, family time, helping others, relaxation, time in nature, creative activities, religious activities, volunteering, community organization, and about 8% of people said getting a pet, right? What is really low on this list, which yes. Yeah. So, thank you. Yeah, so we asked people whether increasing social media led to a reduction in drinking versus decreasing social media. And a larger percentage of people said decreases in social media use helped them reduce their drinking. But there were also a pretty large number of people who said increases. So in other words, being on social media could be an alternative to being out at bars, right? But it was more common for young people to say spending less time on social media contributed to drinking reductions.
That felt like your observation of the rats and having the good accommodation. Like
absolutely.
Social media was an accommodation
Mm-hmm.
that could reduce the behavior or increase it.
Absolutely. Yes. Very few young people went to AA, NA, therapy, all those things, extremely unlikely. So again, if we want to get people before they get really severe, we need other ways to bring them in. And so, all right, I'm going to skip by this, but you all know over the last 20 years, there's been massive changes in how people spend their time. More people spend way more time online. They spend way less time socializing in person, and happiness has decreased with that, right? So when we think about third spaces and sober activities, we have to think about also just improving wellness, right? And so if we want to improve wellness, in-person social activities, exercise, wellness activities are critical, right? And they're correlated with happiness. This is really interesting data from the American Time Use Survey. So the vertical axis shows increases in time for young people over the last 10 years. So solitary gaming, 4 times greater now than like 15 years ago. All the things below that vertical line decreased, right? But things this way are more meaningful. Things that way are less meaningful. So essentially, over the last 15 years, we've all spent way more time doing less meaningful things, right? And way less time doing more meaningful things, right? So this is I think, really important. All right. And so we did this study a while back looking at with heavy drinkers. These were Brown University students. I was there for a postdoc. What are they doing on the nights they're not drinking? And how fun is it? And how fun do they enjoy drinking evenings? And what we found was, sadly, so this is number of drinks. This is enjoyment, right? Look at and this is men in the solid line, women in the dotted line. the more they drank, the more fun they had up to a point. All right. So this is like I said, this is not surprising, right? But look at the men. When men are not drinking, they're really not having fun, right? And as it turns out, we dug deeper. It's because when college men are not drinking, and I assume this might be the case for non-college as well, they're most likely to be alone, right? When the women in our sample were not drinking, they were often alone, but they were more likely to be socializing with other people. And what we found out digging deeper is that as much as the number of drinks was correlated with happiness, guess what was even more correlated with happiness? The number of people you were around. The more people, the more happy, right? So again, just a nod towards social activities, the specific activities that they really enjoyed when they weren't drinking, going to the movies, theater, museum, bars or parties, right? Hat tip to folks with the sober New Year's Eve party. Bars or parties while not drinking, hanging out with friends, eating at restaurants, creative activities were just as fun as drinking evenings. They hated studying, not surprisingly. Okay, I'm going to skip this for time, but there's a study that my colleague Kate Hershock with Native American young adults where she did focus groups. Whenever you're in a community, you really have to ask that community, right? That's just a quick take home here about what's meaningful activities for them. This is what they loved, these Native young adults. So implications. All right. So this has been around for a long time. What I learned recently about the temperance movement in Europe. In the US, the temperance movement was largely like a spiritual movement, right? Against alcohol. In Europe, it was more about policy and design. And what they did when they wanted people to drink less because of the Industrial Revolution and they started to care about having sober workers, right? That's when the society started to care about people drinking a lot, is when they needed people to work in factories. So what they did in the temperance movement in Europe was they built parks and they subsidized coffee shops. My mom grew up in rural Ireland in the 1950s, and there was a membership. They were called pioneers, and it was like a commitment to abstinence, and they had dances, right, and a pin, right, and it was this identity, right. So we've sort of known this for a long time, and then we forgot it, right, and now we're coming back to this. Iceland has done some amazing prevention work with young people, the Icelandic model, where they reduced access to alcohol by enforcing legal, checking IDs in bars, which you think happens now, but I have a college son, and shockingly, he's like, there's bars that they call them freshman bars. He's at UT Knoxville. They don't card. And that blew my mind, because even when I was in college 20 years ago, we at least needed a fake ID, right? Now they're just walking right in. And so we have work to do with that, because that's probably the most important thing we could do. All right. Structural features of the community: access to occupational, educational opportunities, quality housing, third spaces, community centers, parks, green spaces. What specific activities? Social activities, wellness enhancing, exercise, service. People love to learn. Learning is really reinforcing, right? People like to learn about finances, about food, mocktails, coffee, tea, activities that occur during drinking time, right? But also activities that occur during the day, right? Creating structure is really protective against drinking. We need prevention campaigns, messaging that gets people to think about the future, right? And that gets them to appreciate the benefits of sobriety or harm reduction. We also need, this is what I'll close with in the final few minutes, I think we also need brief counseling or digital health tools at an individual level to enhance motivation, right? And that's the work that we've done. It's a complement to more kind of primary prevention work, right? People that are already drinking, they need a nudge, right? To sort of, it's amazing. In the studies we do, we advertise, we just wrapped up a study with non-college 18 to 29-year-olds recruited from across the US. Craigslist ads, Facebook ads, Google, are you 18 to 29? Are you a social drinker? Complete this paid research study. We do an online screening with them. If they report binge drinking, we enroll them in the study, we pay them, they do a survey, and then we meet with them one-on-one Zoom-based counseling session. We don't start by talking about alcohol. We start by talking about, what do you want from life? What's meaningful to you? Tell me a bit about yourself, right? And then we sort of segue into, well, so you want to be, your goals are to really strengthen your relationships. You also want to start a fitness program. You also really want to get this associate's degree or this trade degree. How does drinking fit in with that? It doesn't, right? It doesn't fit in at all, right? Oh, tell me more about that, right? Tell me more about how drinking has gotten in the way of this, right? So this is called let me also the Phoenix movement is a perfect example of the primary prevention approach. So I'm glad that they are here today. But the individual counseling that I'm talking about, we call it the substance-free activity session, right? And it's an individual motivational interviewing based session where the goals are to increase substance-free activities, the salience of delayed rewards, and the extent to which we view our behavior as part of a pattern versus just like living in the moment, right? Just versus just thinking about what am I going to do tonight, but how does what I'm going to do tonight fit into a larger pattern of what I've done over the last few weeks and what I want going forward? And we developed this first with college students. We've now done trials in the armed forces and with the Air Force, large groups, 50 people. We've done studies in addiction treatment. I'm collaborating actually with Dr. Keene from San Diego State University, doing a study with Ugandan fisher people who have HIV and are heavy drinking, and we're increasing substance-free activities in that population. So we've kind of like taken this all over, but it started with college students. Again, the way this session starts is by getting people to think about 2 things you want to accomplish in the next few months that could enrich your life, and then 1 longer-term goal, right? Try to think about things that are feasible and would bring you a sense of joy or accomplishment. We always ask, why is this important to you? Because why elicits motivation, right? So 5 minutes, we're good. And then we have them complete a survey of how they spend their time. And then we give them a personalized chart that shows them how much hours they spend in a typical week across these categories, right? So this person spends 15 hours drinking or using drugs, right? That's more time than they spend in wellness activities and hobbies, exercise, family, friends, right? And then we simply say, which of these categories could you see yourself devoting more or less time to? We never tell them what to do. It's all open-ended questions. But providing this personalized feedback gives them the stimulus, right? And the mental set that tends to make them think about the future. And usually when we present this, they're like, whoa, I had no idea I was spending that much time drinking, even though we got this information from them, right? But nobody thinks about how they spend their time in that way. My graduate student, Jake Tension, created an app. If you guys want to do this, you could use that and do it with people. It's free. We also we ask them what they're interested in, and we find specific activities in their community. We did this across the whole US. All it takes is a 20-minute Google search, right? We find specific activities consistent with their goals and interests, and we tell them exactly where they could get involved with those activities, right? So we make it easy. We try to reduce the response cost. And we ask open-ended questions. You know, which of these do you enjoy the most? Why do you enjoy this, right? What would you like to do going forward? People really appreciate the opportunity to talk about this stuff. It's amazing the engagement that we got in these sessions. A lot of people don't engage in substance-free activities because they're depressed or they're anxious. So we provide personalized coping skills to help them manage depression and anxiety. We give them feedback on the symptoms they endorse, and we talk to them about coping skills that they find helpful and also suggest coping skills that others have found helpful. And then we close with what we call an episodic future thinking episode. This is awesome. It's an experiential, kind of like a mindfulness activity, where we get them to vividly imagine a positive future event that would happen if they achieved their goals. So close your eyes. Tell me about what would happen if you got that promotion. What would it be like? Or if you were able to afford that new apartment in the nicer neighborhood, imagine yourself on a day where you're living there. What would you be doing? What would you feel like? Who would you be with? Tell me the details, right? It turns out there's a lot of research suggesting that when we do these exercises, people think more about the future. They're less impulsive. It's associated with quitting smoking, exercising more, eating less, drinking less, right? So this is episodic future thinking. And we've done a bunch of clinical trials. This is an evidence-based approach. You could see here, this is the blue line is a group that didn't get this intervention. The red line did. What is plotted on the vertical axis is the number of past month alcohol problems, right? So you could see a significant reduction. So again, this is another large trial where we found a reduction over 16 months. So anyway, I think this is a nice complement to the really important primary prevention stuff. And I think there's ways to sort of have elements of this in order to, once you have people come into the third spaces that you create. So I will stop there. I appreciate your attention and thanks again for all of the important work that you're doing.